Okay, so we are trying to look at peripheral nerve injuries. So anytime you say a nerve is peripheral, just get this. If you say a nerve is peripheral, that means what? The brain and the spinal cord is what we call the central nervous system. So any nerve that is outside the brain and the spinal cord, or literally connecting the rest of the body to the brain and spinal cord, we call it peripheral nerve. So this peripheral nerve could have issues. Okay, so and the classification is based on severity and the type of damage. Okay, so we have some two key bodies that usually classify this. We have the Seddon's classification and the Sunderland's classification. Okay, so Seddon's classification, we have things like what? Neurapraxia, okay, Neurapraxia, Axonotmesis. Then we have the Neurotmesis. So Neurapraxia is what? Temporal blockage of the nerve conduction without structural damage. There's like a temporal blockage, but you can't really say there's a structural damage. Then Axonotmesis is damage to the axon. So like this axon inside is supposed to connect, there is damage inside, but the sheath outside is preserved. Neurotmesis is complete, okay, damage. So the sheath outside is damaged, the axon inside is also damaged. Okay, so that's the Seddon's classification. Then we have the Sunderland's classification. So Sunderland's classification, grade 1 is equivalent to Neurapraxia that we spoke about. Okay, blockage but no physical issues. Grade 2 is axonal damage with intact endoneuron. Grade 3 is damage to the axon and the endoneuron. The perineuron, which is outside, is intact. Grade 4 is damage to the axon, endoneuron, and the perineuron. Okay. Then grade 5, there's complete cut in the nerve. All right. So common causes, that's what could actually make your nerves to kind of like have injuries like this: trauma, surgical complications, compressions, infections, metabolic disorders, the rest of it. So that's what we got.